Hey, everybody, and welcome to Hormonally Speaking. I am here today with somebody that I'm pretty pumped to have on here and what we're going to talk about. And, it may be something that some of you have not really thought about in terms of hormonal health. And so it's going to be really interesting to learn about the ways that this particular subject matter can help your hormones. So I'm here today with Dr. Michele Ross, and she holds a doctorate in neuroscience and an executive MBA. As both a patient with multiple chronic illnesses, including fibromyalgia, and a scientist, she has been a leader in drug policy reform, patient advocacy, and cannabis education. Keyword cannabis education there. Dr. Ross is the author of 5 books, including Vitamin Weed, a 4-step plan to prevent and reverse endocannabinoid deficiency. Ooh, I got that right, I think. And the upcoming CBD oil for health. She has created educational courses on multiple platforms, including the Holistic Cannabis Academy, Green Flower Media, and her own sites, including fibrouniversity.com and drmichelleross.com. Dr. Ross is known for breaking boundaries as the first scientist to star on a reality television series in the world, finishing 4th place on the hit CBS series Big Brother 11, which I definitely want to actually talk about a little bit too, because that's pretty amazing. She's been featured on The Today Show, The Doctors, Vice, and many other media outlets, and now lives in Las Vegas. Welcome, Michele.
Well, thank you so much for having me. I can't wait to dive in.
Oh my goodness. So let's start before we talk about the ways that cannabis can help with hormones. Let's talk about your story. And really, you mentioned in your bio that you have dealt with fibromyalgia and chronic illnesses. And so how did that end up leading you to working with cannabis?
Well, the surprising part of my story is that cannabis was actually the origin, and then
Ah.
and then the diseases followed. And it's not because cannabis causes disease. That would be the wrong story here. But I was a neuroscientist. I spent 120 hours a week working with really dangerous chemicals, all sorts of drugs. I was studying cocaine, cannabis, heroin, things like that, injecting animals with toxins all day. And there was actually a lot of chemicals that I was exposed to that they thought was healthy at the time, like not like super like you should be like in a hazmat suit pretty much while you're working in this. And they found out later, and actually a lot of people from my lab ended up with cancer or MS, or in my case I had fibromyalgia. And it's actually not surprising that this might have happened. Fibromyalgia can actually be caused by exposure to toxins. Some people get it after heavy metal poisoning. Some people get it after black mold poisoning. Some people they don't understand why they get it at all. They
Right.
just one day they're hurting, and it takes them about 10 years to figure out exactly what the cause is. Because there are a lot of symptoms that are similar to, say, lupus or multiple sclerosis. In fact, actually, my doctor thought I had multiple sclerosis first, and I went through all the testing to confirm that I did not have that.
I've heard that before, that happens a lot. Yeah.
Yeah, it's frustrating when you don't have any answer. So in my case, I ended up with a bunch of health problems. So here I am. I had studied cannabis for years, but never used it because as a scientist, if you want to receive gifts of scheduled drugs from the government, like heroin, you can't be on other drugs. And they still consider cannabis to be a legal drug that's addictive. It's still a scheduled drug right next to heroin, even though it can be legally sold in the United States at like 30 plus states. It's very confusing law-wise, but as an academic professor teaching students and everything else like that, you can't be on an illegal drug. And so I never used it until after I got out of the lab. And my symptoms really didn't start showing up very strongly until I was out of the lab as well. So I was able to do things like go on TV shows and be very active. I was running, half marathons. I was a very, very healthy person. And then all of a sudden one day I woke up and it was like my nerves in my arm weren't working. I had like, confusion, like all these weird things kept happening to me that were really like nerve based. And it's interesting because I started to pursue a lot of different things. And none of them really helped. I mean, opioids will take away your pain, but make you like not be able to work and, get you addicted and all these horrible things. Whereas cannabis is something, if you use it properly, and you can always use any substance improperly, you could always be just smoking joints all day, not go to work anymore and be sort of out of it. And which is of course not the type of medical approach I
Mm-hmm.
am an enthusiast of. But you can use it in the proper dosing with the proper products to really both relieve pain, reduce inflammation, increase focus. Like there's so many things that it can do. And there's so many ways to use it, from lotions to vape pens to drops you take under the tongue, like a tincture, even like little cough drops and things like that filled with THC or CBD. So for me, it's interesting that I was very well versed in cannabis, and yet I still was sort of reluctant to try it because I knew that it would mean that I couldn't really be an academic professor anymore. A lot of the universities still have some stigma against it, although it's getting much, much better. I would say 10 years ago, though, it was like, if you were the cannabis professor,
Yeah.
you were fired. So in my case, though, I really had to make that decision and go, well, you can't really work anyways. You're really sick. You're bedridden. Your husband's like taking care of you. Like you're not a professor anyway. So
Right.
you might as well, take that leap, go in there. And then what I found was that my expertise was really, really needed,
Mm-hmm.
both as a scientist and as a patient, because I was able to really find out what the gaps were in this knowledge. They were selling cannabis, but there wasn't a lot of, say, guides for doctors or guides for patients, protocols for specific conditions. In fact, I was actually one of the first people, I think I was actually the first person to write about cannabis and lupus almost 10 years ago, and cannabis and endometriosis. And one of the reasons why I was so passionate about those, my cousin actually has lupus, and now it's funny because I got diagnosed as well
Oh,
years
wow.
later. But
Wow.
but also endometriosis was something that I had struggled with. I had
Oh,
gone to the ER with. I had ended up being put on, different medications that shut down your ovaries
yeah.
and can put you into chemically induced menopause. So I had been through the gamut of some really, really exhausting medical journeys, and
Yeah.
even documenting them as a scientist. I was like, how can anyone navigate this if they don't know, any of this, if they don't have the balls to really stand up for them themselves and say, no,
Right.
doctor, I'm not going to take this medication that is going to actually kill me or going to interact with my other medications. It was just such a confusing and stressful journey. And I'm really glad that at least I had some backing to know when I should speak up or not. But I realized that I had to fight for patients that just, they were in too much pain. They couldn't fight for themselves. They didn't have the
Mm-hmm.
education. And in our system, I mean, the United States, our healthcare is tied to our job. And when you're sick, you don't have a job. So it's like, there's just so many factors here that are stacked against patients with a mystery illness or chronic illness or multiple chronic illnesses. Like you almost feel like when you have multiple illnesses, like your doctor doesn't even want to see you because you're that complex patient
Right.
that they
Right.
can't figure out, they can't help. You always have a complaint. Oh, what's new? Are you a hypochondriac? Are you a
Mm-hmm.
drug seeker? You get into all these complex things, and it can really, really undermine like your dignity and self-worth as a patient who's just trying to get better. So I hate the things that happen to me, but I do believe that everything happens for a reason. And I've been able to transform some of that pain, some of that anger, some of that frustration with this medical system, and be able to bridge the mainstream medical system with the cannabis medicine world, and really, bring some credibility to it, bring some structure. And I've been able actually to train a lot of the cannabis health coaches and doctors across America and in other countries as well. So it's been a really cool journey. But man, if I could have skipped some of those years of pain and just had cannabis as the
Right.
first line therapy, oh my
Right.
goodness.
Right. And, I think many of us definitely in life experience something that leads us to what we're, supposed to be doing, or the ways that we're supposed to be helping in the world. But it's always like, ugh, why did I have to go through all that to get here? But I think, some of the listeners can really, um, they really feel you when you talked about that struggle of getting, doctors to listen to you and having to advocate for yourself, because that is so particularly for women. And we know this from research that, our pain is not seen as real as much of the time. The
Mm-hmm,
hypochondriac word definitely comes out in a big way. And for Black women, it's even worse. We know that,
mm-hmm,
and so you have so many women that are really living with chronic pain that doesn't need to be that way, right?
mm-hmm,
There's lots of options. So going back to one thing that you said about, the different forms, I'm really curious about this, especially the idea of it helping you to focus? Because, you know, for me, weed does not help me focus. And so I'm curious if part of that is like the form that you take it in, or is it like timing, or I know there's different types too, obviously, the ones that like give you more energy and the ones that take you down, but I'm definitely curious about these forms. If you can
Mhm.
talk a little bit about that.
Absolutely. Well, most people are familiar with cannabis in the form of flower or bud. And so,
Mm-hmm.
they smoke a joint, a
Mm-hmm.
bong, a pipe, or something like that. And, that does hit you within 10 minutes.
Mm-hmm.
It can make you sleepy. It can make you hungry. It can reduce your pain depending on what type of strain you use. There's thousands, if not like hundreds of thousands of strains out there because they take these plants and they cross them and they each have these medicinal properties.
Mm-hmm.
They can also make that flour into what we call concentrate.
Mm-hmm.
So it's just like they basically take all that green matter down, make an oil out of it, and then you smoke that. It's supposed to be a little bit cleaner. But you get pretty much the same effect. So a vape
Mm-hmm.
pen is almost similar to a joint, just less smoke.
Gotcha.
So,
Mm-hmm.
but in terms of what would you smoke to be able to get some focus, there are some patients that really do find certain sativa strains, and
Mm-hmm.
like what we broadly consider daytime strains, like sour diesel or sour tangy is actually a huge favorite for
Okay.
something that will increase your energy, increase your focus, but not make you distracted, not make you daydreaming. Sometimes people actually consider it almost like the equivalent, especially if they have ADHD already, sort of
Mm-hmm.
like an Adderall or a Ritalin. And
Oh,
people are very
interesting.
confused. They're like, how can cannabis act like a stimulant?
Right.
But again, it has these specific chemicals called cannabinoids and terpenes that do actually create these changes in your brain that help you be focused. And for me, actually, I can't smoke cannabis containing just THC during the day without being distracted myself, even though I'm in a
Mm.
lot of pain and brain fog and like lack of focus is actually one of the symptoms of fibromyalgia. And I can't be
Mm-hmm.
out there as a clinician talking to patients and be like, I forgot your name. I don't
I forgot
remember.
what I was
What is
talking about.
marijuana? I don't know. You
Right.
can't, you can't
Yeah.
do
They're like,
that.
oh, really?
So, you have to be on point. And
Yeah.
so, for me, I actually try to avoid THC for most of the day, but if I do have, say, a little blip or something, I'm like
Mm-hmm.
between patients, I might just take one or two puffs. It's all about
Mm.
dosing. So less
Mm-hmm.
THC is better for focus. A lot of
Mm-hmm.
THC can make you sleepy or more out of it. So
Mm-hmm.
dosing
Make
is,
you want
is
to
really
eat.
important.
That's
Well,
me.
there's strains that can then stop that too. But, that I could probably talk for like 10
I
podcasts
know.
on the different strains. But
Right.
the next method, actually, and it's funny too because people don't realize you can put like certain cannabis products in food, but one of the best things for attention and focus is actually a CBD coffee. And so they even make like
Mm.
Keurig pods that have there are coffee infused with hemp oil. And so hemp
Mm-hmm.
oil is basically just CBD. It doesn't really have any, or it's negligible amounts of THC, but CBD plus caffeine actually really helps you focus and it reduces the jitteriness of it. So
Mm.
if you have anxiety, if you have fibromyalgia, which is a condition that is really sensitive to caffeine
Mm-hmm. For
and can
sure.
actually cause panic attacks and things like that when you
Mm-hmm.
drink too much. For me, that's another way to be able to easily get the energy I need, but also not be crashing and not
Right.
also be like a little shaky. And so that's great. Some people prefer to put CBD oil directly in their coffee. They put a couple drink
Mm.
drops of a tincture in there.
Mm-hmm.
That's the same basically method. Some people also will just put one drop of THC or something. So like a microdose of
Mm-hmm.
THC where it's not making them high, but for some reason, with their brain chemistry, it's helping improve their mood and their focus. So maybe working on the serotonin system. We're all a little different.
Yeah.
What I love about THC and CBD in cannabis is that it basically brings your systems back up to balance. And of
Mm-hmm.
course, balance is the word for so many of our
Right.
systems,
We
from
want
hormones
to,
on
yeah.
down. But
Yeah.
we don't know what's wrong with each and every person, right? Is your GABA system off? Is your dopamine system off? We
Mm-hmm.
have all these different neurotransmitter systems, and what's beautiful is that the endocannabinoid system is actually your largest neurotransmitter system. It regulates all the other neurotransmitters and some of the hormones as well.
Mm-hmm.
And so, it's nice because it's like sometimes we're searching for that diagnosis. We're trying to figure out like what is wrong with us. And sometimes you don't have to put too much thought into it. Literally, you consume this
Mm-hmm.
plant extract and whatever is wrong, it's going to either dial it up or dial it down, depending on what is wrong, and bring you back to balance. And because you have these receptors everywhere,
Yeah.
like
Yeah.
literally they are everywhere, except for the part of your brain that controls your breathing, which is why you can't overdose and die from cannabis like you do
Mm.
opioids. Like literally they're everywhere. They're in your skin, they're in your heart, they're in your brain. You know, basically that's nice is when you consume cannabis, you literally can get those receptors all throughout your body activated and back to balance and healthy. So I really do love that. And that's one reason why it works for pain and inflammation and focus and all the
Mm-hmm.
things. And it's like, seems too good to be true sometimes. I would say that, you know, if you are looking for something specific, like if you're like, ow, my foot hurts, like there are ways to like directly get it all to your foot as opposed to being like,
Mm-hmm. Mm-hmm.
well, I smoked it and it went throughout my body, right? Like there are topical applications where you can put things, you know, for
Right.
pain directly on places and things like that. But with focus too, like another thing that people do, especially if they don't want to say can get THC in their bloodstream, like some people will even like, you know, use topicals like on their neck or on their temples or things like that. Like people get headaches. Like you can mix
Mm-hmm.
these cannabinoids with essential oils like peppermint oil. That's actually a really good one. If you don't want to get high, vape pens that just have CBD and
Mm-hmm.
peppermint oil are actually really, really great for
Mm.
focus. Will not get you high at all. Some people get a little sleepy from CBD. Most people get energized. Again, it's like
Mm-hmm.
you're that person that falls asleep with a cup of coffee, maybe CBD is probably
Gonna
not
also,
good for you
yeah.
during the
Yeah.
day. But you know, with everything, right? You know, all medicine is really personal, and I would say that cannabis is really personalized medicine. If you are thinking about using it, you know, for focus, for pain, for any of these different reasons, I would keep what we call a cannabis journal, which could be a blank notebook that you're just like, well, I tried the CBD coffee today. How did I feel? Was it better than my normal coffee? Was it worse? You know,
Mm-hmm.
how
Mm-hmm.
was this vape pen? How did it make me feel? You know, you want to look for things like, you know, your pain levels before, your pain levels after, your focus levels before and after. And it's going to be a lot simpler with something just like CBD.
Mm-hmm.
Because it's not psychoactive when you
Right.
bring in THC into the equation, because THC can change how you feel depending on the time span. Like the first 30 minutes, it can make you feel a certain way. And then the next hour, and then like the last 4 hours, you know, can feel something different. So I would say that if you are planning on consuming a cannabis product, whether you're smoking it, eating it, drops, etc., and you're going to use it to where it will be psychoactive, you're not using like mini drops or something.
Gotcha.
I would say, yeah, just
Yeah.
track your journey and make sure that it's enjoyable and also beneficial for you throughout that entire time that it's working, whether it's that 4 to 6 hours or for something really, you know, short acting, you know,
Mm-hmm.
just even that 1 to 2 hours.
Yeah. It's interesting as you talk, I really, the word adaptogen pops up in my mind that this
Yes.
essentially kind of acts like that. I mean, and even with herbal adaptogens, you have to figure out still for yourself how that's going to work. But the idea is an adaptogen helps you, whether you're, like, for example, with cortisol, which is such an issue for so many people,
Mm-hmm.
that it's either too high or too low for a lot of women. And that underlies a lot of hormonal issues. And so, really, thinking about even the coffee thing, adding CBD to that, I almost wonder in that case, can it act like an adaptogen for your adrenals and not really push your adrenals like just straight caffeine does, if that CBD sort of helps to counteract that aspect, like it seems like it, helps with fibromyalgia. It's really fascinating to think about that. But I do want to clarify because I was like, oh, I don't really know. Is cannabis the umbrella for both THC and CBD? Or is cannabis like, I've always thought of cannabis as just meaning the THC portion.
You know, it's interesting because there's a lot of confusion around that, but the
Mm-hmm.
cannabis plant, whether it contains like mostly CBD or mostly THC,
Mm,
is actually still the cannabis sativa plant. That's the
gotcha.
scientific name for it. And so
Gotcha.
the distinction between what is a hemp plant and what is a marijuana plant is
Mm-hmm.
actually legal. It has nothing to do with the plant world.
Mm-hmm.
So what happens is that the plants that make more THC lack the enzyme to make CBD, or like it's less
Oh,
produced. So it's
okay.
just about their genetic expression.
Gotcha.
It's not really like they're two different plants. And so when we talk about cannabis, we do include hemp CBD products and things like that. There are some products like the plant will always produce a little bit of THC with the
Mm-hmm.
CBD. Like there's no plant that will completely, only make CBD, because like
Mm-hmm.
there's actually like a stem cell in the plant that actually like makes certain cannabinoids. And so like CBD and THC come from the same like stem cell cannabinoid in the plant. And it's like
Gotcha.
enzymes that turn them into those two different things. So
Okay.
all plants will make that. We actually, if you ever get like say a tincture or a product that says 100% THC free, we
Mm-hmm.
actually had to chemically remove the
Take it out.
THC
Mm-hmm.
from that. So most of
Gotcha.
them will have like very little, but it'll still be there. So just
Mm-hmm.
so you know, it is part of the plant. Even it's interesting because we talk about, like, okay, limited THC in these CBD plants, but interestingly enough, the THC plants actually used to have a lot more CBD in them. And over time,
Mm.
we actually bred these THC plants to express a lot of THC, almost no
Mm-hmm.
CBD, because the point was, let's get people high,
Yeah.
especially on like the illegal market. And now
Right.
it's interesting because there's a shift now where people are saying, wait, I really want some CBD with my THC, especially for pain patients,
Mm-hmm.
patients with anxiety that want to be able to be, say, functional during the day. We have a lot of
Mm-hmm.
working professionals that use strains that are either like what we call 1-to-1 ratio, where they have equal
Mm-hmm.
amounts of THC and CBD, where they don't feel high, but they feel medicated, or they feel calm, whatever it is they
Mm-hmm.
need to do. And that's actually a really great ratio for a lot of things. It's also been clinically proven for nerve pain. So,
Mm-hmm.
that's actually like a nice starter dose. When I tell people, like a lot of women, for example, are very scared to use cannabis, especially if they've
Mm-hmm.
never had like an experience with it, or worse, they've had the bad experience. Like
Right.
somebody gave me a infused donut one day, and I was high, and I got
For
lost.
18 hours.
Yeah, those are real stories. And we're
Mm-hmm.
like, okay, this is what's going to happen. And we're going
Mm-hmm.
to, ease you in. Usually CBD is sort of like the gateway
Right,
to
right.
cannabis
Especially
medicine,
these
where,
days.
yeah,
It's everywhere, right? Like I
yeah,
mean, there's
yeah.
like so many stores out there and so many places you can get it online.
Although I would
Yeah.
say, quality is everything. I've seen a
Yeah.
lot of CBD products, say at the gas station. And so I see,
Yeah. Don't do
thousands of
that.
patients via telehealth, and they're like, oh, I tried CBD for like 4 months and it didn't work. And they're like, what did you do? You're like, I ate a CBD gummy once every 5 days. And I was like, you have a serious illness. Like, that's not how
That's
you
not gonna
treat
help.
it.
Yeah, yeah, yeah.
And then like, where did you get your product from? So I
Mm-hmm.
always, ask people, where did you get your product from? What's important with CBD too is like, was it made from hemp that was grown in the United States or in another country? Like,
Mm-hmm.
what kind of chemicals did they grow it with? And these are questions you don't normally ask. You're not
Yeah.
like, where was my Xanax produced? Would they have
Right.
put weird stuff on it? And it's because we have a lot more regulations around pharmaceutical products than
Mm-hmm.
we do supplements, and even like less in the CBD and
Mm-hmm.
cannabis industry. But I would say is that there is a difference in supplements, right? Like one
Yeah,
fish oil from one company might contain some mercury and the other one might be
absolutely.
fine, or the other one might have more milligrams of the active ingredient and things like that. So, as a consumer, if you are going to treat, some of your symptoms holistically, it's up to you to do sort of like that due diligence and make
Research.
sure
Yep.
what goes in your body. Like CBD gummies, like it's really easy to think that those are almost like candy because they're
Yeah.
sort of marketed like
Yeah,
that. But
totally.
there are drug interactions and things like that. What most people don't realize is the edible forms of CBD, not
Mm-hmm.
drops you put under the tongue, but CBD drinks, CBD gummies,
Mm-hmm.
other CBD edibles. They can interact with about a quarter of medications. And I mean,
Mm-hmm.
from blood thinners on down, and people have no idea. They're like, oh, I feel really good. I was like, well, you might have had an elevation of your antidepressant at the same time. Like,
Right.
it's like that might have actually been
Been part of it.
yeah. Whereas a
Yeah.
healthy person eats a CBD gummy, and for the most part, like nothing actually happens because the
Right.
dosage is too low or their body didn't absorb it. So I would say, if you are a new patient, I would say try to, avoid gummies. They're not the best, although I would say some THC gummies work for sleep beforehand, but the
Mm-hmm.
CBD gummies have been like a pretty pretty strikeout zone in terms of
Okay.
efficacy. So if you're new, try some CBD coffee or get a vape pen or something, but like try to save your
Stay
money and don't
away.
get the
Yeah.
gummies. Yeah.
Yeah. I mean, just generally, you're just not going to absorb. I think, it's just not as bioavailable as if you're going to do the tinctures and oils and everything. Um, I was wondering because I remember reading at some point that THC can act more as an inflammatory system or hit the inflammatory system while the CBD is anti-inflammatory. Is there any truth to that, or is that just completely wrong?
Yeah, so THC is actually a more potent anti-inflammatory than
Mm,
CBD is. It's about 20 times more potent of an anti-inflammatory,
okay.
but it does have some pro-inflammatory actions
Mm,
as well. So
mhm.
it can be a little bit of a double-edged sword, but for most people, again, most people with chronic disease have really, really high levels of inflammation and
Mhm.
compounds like CRP. So it's actually nice. Both compounds have been shown to decrease inflammation throughout the body. So you're
Nice.
safe whether you use one versus the other. I
Yeah.
really hate the comparison sometimes between THC and CBD because a lot of times this comes up where people sort of like demonize THC because
Right.
it is something that gets
Because
you
it makes you
high.
high.
And
Mhm.
then they say, well, there's no medical qualities. Only CBD is medical, because it doesn't get you high and it can reduce inflammation and things like that. But THC actually has much stronger effects at your cannabinoid receptors,
Mm.
particularly CB1 receptor, cannabinoid receptor type 1. And so this is the same receptor that modulates, euphoria and things like that, but it's also the one that's going to modulate the pain reduction, the inflammation reduction, and things like that. The CB2 receptor is another main cannabinoid receptor. It's actually found mostly on immune cells. It's actually really interesting, in terms of certain inflammation models and autoimmune disorders and things like that. But like the most of the actions for THC are happening on that CB1 receptor, whereas CBD actually doesn't really bind to those receptors. It's naturally elevating your own marijuana-like compounds called endocannabinoids, which will
Mhm.
bind to those two types of cannabinoid receptors. So it's much more
Gotcha.
gentler. Like I would say, like, if you have like, I don't know, like a narcotic for pain
Mhm.
versus like, I'm going to take regular Tylenol, like CBD is like the regular Tylenol and THC
Right.
is the extra strength stuff. And I really do like combining the both of them because they do actually hit different receptors. Even
Mhm.
CBD can actually hit a serotonin receptor. People have no
Mm.
idea. I was like, CBD oil actually activates a specific subtype of serotonin receptor. And that's why it's really helpful for anxiety, for sleep, and for
Mhm.
certain things. Whereas THC can, like tweak maybe a little bit about the serotonin system, but it's not directly activating that. And so each
Interesting.
of them have such amazing, really cool benefits. Like literally CBD, people don't even realize like CBD can hit, I don't know, like 50 different receptors. It hits receptors that block cancer. Like it does all sorts of
Mhm.
things. Like it's a very complex drug that we give in gummy form, which is ridiculous.
Right.
But again, it's just like, I was like, this is actually a powerful, amazing thing once we understand what it's all doing.
Right. Right. And
But
I
sorry.
think, like what you were explaining earlier about them coming from the same plant and that you're always going
Yeah.
to have them, that makes sense, right? Like whenever we start to separate things and only give one of a thing, one aspect of a thing, then we're not getting the full, power of that. And so when you're sitting there saying, yeah, do 1-to-1 or whatever of CBD to THC, that makes sense to me because that's how it was created, right? And so it's
Yeah.
going to act on many more systems rather than that separation. And I mean, we do that with vitamins and minerals all the time, and then we find out, well, oh, it's actually not good to take calcium on its own, because that
Mm-hmm.
impacts your magnesium levels and stuff like that. So
Mm-hmm.
that makes definitely a lot of sense to me. Can we talk a little bit about your fibromyalgia journey? Like, first of all, I think most people probably know about fibromyalgia at this point, but explain a little bit about it for people that don't know. And then, like, exactly kind of once you started bringing cannabis, how that impacted your journey.
Sure. So, like most patients, I wasn't really sure what was wrong with me. So,
Hmm.
I had already had some health crises that happened right before. So, again, my very first intro into like they say that the healthcare system was when I woke up one day, my arm wasn't working, and like literally my wrist wasn't working. I had palsies, two different types of palsies, like, and so I had my nerves in my wrist and like my neck just stopped working one day, and I
Oh
was
my
like,
God.
okay, well, this is interesting. Like,
Yeah.
and cannabis actually helped wake those nerves up.
Mm.
But obviously I was like, well, what was causing this? What was underlying this? Like there's something off. And then I started like losing my appetite, getting sick, getting pain. And eventually, like a year later, I ended up with blood clots in my lungs and my legs. And like, it's
Oh,
just like everything
wow.
just like, no one could figure out what was wrong with me. I kept getting sicker and sicker. I was actually exposed to heavy metals in my apartment in Los Angeles. So that was
Oh,
trigger for
no.
one of
So
these things. Yeah. I was just like,
alongside where you had worked. Wow.
yeah, it was great. I work from home, so I'm like there like all the time.
Oh,
Like apparently
no.
in this place with like heavy metals, like literally my apartment building got raised. They're like, we had no idea that there was like literally earthquakes and there's like lead like from the ceiling,
Oh my
falling all
God.
over dishes everywhere. They're like, dude, if you had a pet in here, it would have died. I'm like,
Oh, that's horrible. I know. And so many people, have been exposed to heavy metals on much larger levels than they realize.
yeah.
And that's a huge part of a lot of sicknesses for sure.
Yeah, and I mean these illnesses, they come on really strangely, and like you read the symptoms and I was like, I think I have lead poisoning, but it's supposed to be for like little
Mm,
children. I'm like, I must be a hypochondriac. And I
right.
get tested and I was like, yep, me and my husband were like, they're like, are you alive? Like,
Yeah.
holy crap. And so he doesn't have really any underlying condition, so he
Mhm.
was, he
He's
he
like,
was
I'm all
sick,
right.
but like okay. And then
Men.
here I am, I'm like crawling, I'm like, I can't eat, I lost like 40 pounds, like I'm dying. And after that happened, I recovered, and like literally I wasn't even supposed to recover. Like I had a 10% chance of like living through this
Wow.
horrible, I had hundreds of blood clots in my lungs. And so really weird. I had a really weird, like medical journey. I should actually probably write a book about that because it's like
Absolutely. It's
fascinating.
important, yeah, for people to like
Yeah.
understand these things that can happen.
Yeah, because I mean, even as a scientist, you're like second guessing yourself about some of this stuff, and the doctors will tell you there's nothing wrong with you. Go
Yeah.
home, take a Tylenol, and you're like, I think there is.
Yeah.
And so,
And you're like,
I
Tylenol is going to hurt my liver worse right now, actually. Thank you.
yeah, and so here I am trying to solve my own medical mystery while like barely being alive in the first place. And it ended up actually taking a move from Los Angeles to Denver, Colorado, where
Mhm.
they have a much more they have better healthcare system. At this time I was on Medicaid, so it was even worse. Like I lost my job, my
Mm.
husband's taking care of me full time, so he's not
Huh.
working. So we ended up on Medicaid, and there is
Mhm.
definitely a difference in treatment and diagnosis and priorities on people that are on private health insurance versus public
Mhm.
health insurance. But
Mhm.
I knew that in Los Angeles, on the public healthcare system, where there was a backlog of like 4 months to go see like a specialist or something. I was actually one of my specialists. One time I was supposed to go for like pain, and they referred me to a pediatric epilepsy doctor, and I was like, I don't have
What?
epilepsy, and I'm not a
I'm not a
child. Why
kid.
am I here? And like, like it was just like I was like, I'm gonna die. Like I think
Yeah.
I'm actually wondering if they want me to die because I'm such a drain on the medical system right now.
Right.
And like it's
Wow.
you have to think about that. Like, why are they
Mhm.
sending patients to the completely wrong doctors? And it's like they treated you really badly in the system.
Right.
So I went to Colorado, and like almost immediately, like doctors started like actually caring and taking care of me.
Wow.
And I was able to have much more open conversations, also because they had medical marijuana was legal for adult use. There was slightly less stigma about it, although still stigma. And it
Mm.
was funny because some of the things that had happened to me, I was not on cannabis at all.
Mhm.
And yet I would still, somebody wrote in my file that I was a drug abuser because I was on medical marijuana. And so like, I always have these conversations where I'm like, I'm not here for pain management. I'm here to like figure out what is wrong with
Yeah.
me.
You're
Like,
like, I want to
I
get
just want a
better. Yeah.
diagnosis. Yeah.
Yeah.
Like, do I need hormones? Do I need like, what kind of things do I need?
Mhm.
And finally, it was when I wasn't getting better from after the blood clots. Like I was tired, I was achy, I couldn't think, and they're like, maybe you have brain injury. Like, and got scanned, and they're like, well, you don't have brain damage from this
Mhm.
because you don't get oxygen, when
Mm.
you are suffering from blood clots, things like
Mhm.
that. So it was possible I had brain damage. Had like a tiny little bit, like not enough to actually like make my symptoms happen. And
Mhm.
so one of the things I noticed was like my husband, it was really hard for him to touch me, and I was just like, ow. And it was like all these places I was like, don't hug me, don't touch me. And he was
Mm.
just like, okay, you're a totally different person after this. And
Mhm.
it turned out, because my husband was the only one touching me, that was actually, hey, like I had these tender points all over my body, and that's one of the ways that they diagnosed fibromyalgia. My doctor
Mhm.
was like, yeah, I was like, these weird places, like you don't get bruises in weird places, like behind your I don't know, like your like knee, ankle things,
Right.
like it's like really weird. Like fibromyalgia tender points are in weird places, and you
Mhm.
just think like you're sort of crazy. You're like, oh yeah, like above my rib cage right here like hurts, and you don't think about it. You're like, maybe I bumped into something. But it
Right.
turns out, like, yeah, systematically, if you hurt in these places over and over again, that's one of the symptoms. Also, like nonstop, like aching, burning. Everyone like
Mm.
has different symptoms. But the one common thing is that it's not going away. It doesn't say progressively get worse, like MS or something like that, but it's there every single day. And if you're a
Mhm.
working professional like me, I was like, okay, if this crap happened, I want to get back to working. And I was
Mhm.
like, at this point, I'm not going to be able to, because I'm in so much pain. I like literally want to die. Like,
Mhm.
and it was just awful. And, of course, they can give you opioids for
I was
pain.
going to ask.
Opioids don't
That's
really.
what they offer for fibromyalgia. Really, is opioids,
Yeah,
right?
and
Yeah.
so I ended up on morphine, like goodness. And here
Mm-hmm.
I am, I'm an addiction neuroscientist. That's actually my
Mm-hmm.
specialty. And
Wow.
it's funny because I know about this, but when you think about people like, well, a heroin addict is different from somebody who's a pain patient who's given morphine. You're like, actually, your body doesn't
It's
know
the
the
same thing.
difference.
Yeah.
And
Yeah.
even if you're not abusing it, if you're taking, say, high doses of oxycodone and morphine for a year plus, your body is going to be dependent on it. Your
Mm-hmm.
body's not going to like it when you're off of
Mm-hmm.
it. And I actually ended up with a doctor who did a surgery on me for endometriosis and was like, oh, you don't look like you need these pain pills anymore. It looks like your insides are much better, and just yanked me off
Just
of
took it
pain
away.
pills.
Ooh,
Took
yeah.
them off. And I was like, I've been on morphine for a year and a half. You just like literally cut me off. I went through
Wow.
withdrawal and I was like, that was so irresponsible. Um,
Absolutely.
Absolutely
And that's
irresponsible.
happening a lot these days because of the, opioid crisis or whatever, right? That people are just
Yeah.
getting it taken away from them. And it's not the approach. You
Yeah,
have to
it's
wean
very,
people
very
off here.
dangerous.
Yeah.
I would say that if I had not had access to cannabis, and there's a difference between taking a couple like CBD drops and taking a dose you need to actually wean yourself off of high doses of opioids. It's like
Mm,
ridiculous. Like people are like, oh yeah, you could probably take 500 milligrams of THC while you're going through opioid withdrawal and be fine, like be
wow.
awake. Whereas
Right.
like that would put you to sleep for 3 days
Yeah.
normally. But like that process is so just dramatic, let's just
Mm-hmm.
say, and the symptoms are really bad that you can actually tolerate a lot more. So here I
Mm,
was, I'm a neuroscientist trained in addiction, actually sort of horrified that my doctor didn't like actually compassionately think about this
right.
and was just probably like, oh, she's a weed smoker, she'll be fine. I'm like,
Right.
and it was not a fun process. And it's actually been one that I've been made sure to really focus on, some of my work on women that have had the same experience, whether they've been
Mm,
cut off of their opioid medication or they're no longer able to get it for whatever reason, and to help them, be able to taper down with dignity and the
mm-hmm.
least impact on their health. But for me,
Nice.
it was actually the best thing was to get off of these horrible drugs. Lyrica was another drug that like caused me to gain 50 pounds, made me slur my words at times, which was really not
Mm,
cool, and then didn't really help with the pain. What I noticed with fibromyalgia and even some of my other medical conditions was that these medications that were supposed to be amazing really didn't do anything, yet they had a laundry list of medications. Like one made me hallucinate. I was just like, this is supposed to help with pain? Like
I
I
know. I
was like,
know.
no. And cannabis never has any of that stuff. I would say that cannabis isn't right for everyone. There are some people that say have heart rhythm problems and things like that need
Mm-hmm.
to be careful or not use it at all. There are some people that, no matter what they do, they get like a little psychotic, and it's like you might have, some kind of genetics in there,
Right.
that you didn't get schizophrenia, but you are more on the borderline of potentially having a psychotic episode or something like that. Like certain people shouldn't use it, but for the most part, like if your side effect is like, I'm going to order a pizza, like it's not a big problem compared to I can't do my job, or I have so much diarrhea that I'm like have to take 4 other medications for this. I've
Right.
just the quality of life is much more improved. And I would say for fibromyalgia, I do use cannabis in multiple ways.
Mm-hmm.
I use lotion, and people are sometimes surprised. They're like a THC lotion, like a weed lotion that really works. For some of the spasms, the pain, specifically that
Makes
nerve
sense.
pain in the legs and
Mm-hmm.
feet, it's actually amazing because, your skin is really thin in certain parts, right? Your
Mm-hmm.
hands, your wrist, your back of your neck.
Yeah.
And cannabis is actually formulated usually with other like essential oils that help it penetrate deep in. So it's not just laying in your skin, it's going into your muscles, into your joints. It's helpful for arthritis pain, fibromyalgia pain, back pain, sciatica, things like that.
Mm-hmm.
And so for me, it's one way that I can use it during the day, really control that very specific pain without having to smoke or be high accidentally during the day. So it's a
Mm-hmm.
great way for professionals to deal. It's also, I love to put it on before I go to sleep. I never wake up with Charlie horses or cramps or have to like get up in the middle of the night. I have a really, really good sleep. Um,
Mm-hmm.
Now, speaking of sleep, that's like the basis of all diseases. You don't get sleep, your
Right.
disease gets worse. You're on that like little wheel.
Trajectory.
Um,
Yeah.
yeah, in terms of sleeping, I do actually tolerate cannabis a little bit better when I go to sleep. Like most people do. You don't know if you're high, if you're sleeping.
Right,
Your body
right.
is just,
Yeah.
but like I get really dizzy from THC. And so the amounts I would need to 100% kill my pain during the day would make me fall asleep. So,
Mm-hmm.
so for me, I consume most of my THC dosage at night. So I actually do take a THC gummy. It's best actually, your body absorbs more of it if you eat it with a fatty meal. So if you eat like a glass of milk or a piece of cheese or something, you're actually going to absorb much more of it because THC and CBD are fat soluble. They're not
Mm-hmm.
water soluble. So you
Mm-hmm.
have to eat them with fat.
Nice.
And so I just make sure I literally eat the same amount of fat every day. So my dosage is exactly the same. So I eat my gummy, my little piece of cheese, go to
Nice.
bed, and that THC will kick in. I don't take a tremendously high dose because we do know that THC can interfere with sleep, just like,
Right. If it's too high, yeah.
a glass of wine might help you go to sleep. The bottle is going to give you not so
Yeah.
great sleep.
Yeah.
We do know that THC can interfere with sleep after it's like you've reached over like the 20 milligram mark, but around
Mm.
5 to 10 milligrams can be helpful for both sleep and pain. And so,
Oh, that's
I use, more responsibly. A lot of times people think if you're a medical marijuana patient, that means you're just home
all
smoking
the
weed all
time.
day. One, I do have patients that do that. And
Yeah.
if that fits into your lifestyle, and that's okay. But like
Yeah.
for a lot of people, they're like working moms, especially like during COVID, if you're a mom, like a professional,
Right.
like your kids are running around, but you need to manage your pain, like smoking cannabis in front of your children, not exactly, responsible. So, these methods where you're taking drops, or you might be able to use a vape pen or things like that, or just more responsible ways of consuming this medicine. And,
Right.
I do say that there's still there's so much like a steep learning curve. It's not as simple as just take the Xanax bar or take your
Right.
morphine
Of
pill.
course. Yeah.
But,
Anything
that's,
natural is going to take a little longer to figure out.
yeah, but
Yeah.
for each of these conditions, it's so different. What you prescribe or like recommend, say for fibromyalgia, is very different than what you would recommend for menopause and things like
Mm-hmm.
that. And so
Mm-hmm.
even though it's just cannabis, it's still, there's so many like layers of complexity to it.
Absolutely. And I definitely want to get into the menopause issue here in just a minute, but I do have a quick story of the time that I feel like I was very much helped by a lotion, and it's actually a friend's mom that makes I guess it's a lotion, whatever. It's something that
A
you rub on
salve or
you.
balm
A
or something. They
salve,
have all the
exactly,
words
whatever.
for it.
Yeah.
Yeah.
And it was THC and CBD in it. And people that have listened to this podcast know about what happened to me, but I had a fibroid surgery go wrong unknowingly, and they burned me in 3 places in my intestines,
Ooh.
and I ended up with sepsis, but I didn't know I had sepsis. So it was like 2 weeks in between the surgery and then when I landed in the ER. And I will tell you, the only thing that helped, I had such pain on the right side of my body because that is where my the stool and fluid was dumping into my abdominal cavity where it's not supposed to
Yeah.
be. And I actually had, like, in order for me to be able to sleep at all during that time, I was just rubbing that
Mm-hmm.
THC and CBD salve on me. That was the only thing that brought down the pain. And so that kind of showed me how powerful it was. Because even when I had sepsis, which, is just trying to take you out,
Mm-hmm.
that still at least brought down that pain during that time. And so I definitely continued to use it after I had emergency surgeries. And after that, it was literally pretty much the only thing that helped, because even all the like, talk about being on medications and
Mm-hmm.
opioids and all the things, I mean, I'd never been on any of that kind of stuff. And, I ended up being on like literally all of it while the 2 weeks I was in the hospital. And I feel lucky that I don't have an addictive personality in terms of that stuff. And so, I was able to wean myself off pretty well after I got out, which I was grateful for. But really, I mean, using that salve was such a huge thing. So yay for that, just putting that out to people. And I mean, obviously with
Mm-hmm.
fibromyalgia, that's such a big thing that it takes over your day, is just that pain in your body constantly.
Mm-hmm. And I mean, it's the stress too. So it's like,
Yeah.
it's interesting because it's like, there's obviously different levels of functioning with fibromyalgia,
Mm-hmm.
right? A lot of people are actually on disability. And so I would
Mm-hmm.
say this disease can be easier if you're not dealing with daily stresses or things like that. But like, my work as a CEO was like, I was flying around all the
Yeah.
country, having to keep up with people that were doing like 16-hour days, walking an entire like convention center, like 18 times in a row, standing on my feet. Oh, you should be wearing heels. Like you should be
Right.
wearing flats. Like it's like
Like,
trying to keep up as if you don't have a disease. And you're like, and
right.
then they're like, let's go to the after party where you can meet these other CEOs. And you're like,
Yeah.
like
Like,
it's
I ain't got that in
overwhelming.
me.
It's like,
Yeah.
So, you know, in order to function like that, you really do have to really use every tool in like the toolbook, like the
Mm-hmm.
toolkit, sorry.
Yeah.
And it's like, I sometimes have to be a lot more intensive and intentional about like my use, rather than somebody that is, say, you know, relaxing or has like a really easy job or things like
Mm-hmm.
that. And so you always have to think about like, how can we get you up to the speed where you need to function, you know? You
Yeah.
can just be on opioids and not work, but like, is that a fulfilling life?
Right. Right.
And you know, I'm sure you wouldn't have wanted to be like, say, disabled or retired or anything like
Yeah.
that. But I'm glad to hear that the lotion really did work. And it's interesting because people don't realize that THC and CBD also have antibacterial, antiviral,
Mm-hmm.
anti-fungal properties.
Mm-hmm.
I actually have a close friend that almost died from MRSA
Oof.
and was treated with cannabis oil and survived. And so there's a lot of cases where cannabis can actually make even like antibiotics work better.
Yeah.
There's a
Yeah.
researcher in Israel, it's like the grandfather of cannabis, and they actually said that, yeah,
Yeah.
cannabinoids are actually going to rescue us from all the antibacterial like resistance that we're getting.
Resistance though, yeah. And
Yeah.
I mean, it's like my dad was in the hospital earlier this year, and the sleep issue was so bad, especially when, with older people, a lot of times post surgery they have a lot of trouble with sleep. And I was
Mm-hmm.
like, asking one of the nurses, I was like, can I bring CBD in? And he was like, I'd love you to. He said, I know it works for me. He's like, but I'm not allowed to let you bring it in, And I was like,
Mm-hmm.
God, these are the changes we need to make. And I mean, like with sepsis, we know vitamin C is very helpful, even if you have to do IV antibiotics, but like
Mm-hmm.
the vitamin C aspect helps a lot. And it's like, if we can bring in these, at least get to this integrative place where we have enough research, right, on a lot of these things to know that they support faster healing and less pain overall,
Mm-hmm.
and yet we still stay stuck in sort of this old school ways of doing things, which is, unfortunate. But that's part of why you're doing the work that you're doing, right? I
Yep.
mean,
And
yeah,
I mean, I think legalization is a big part of it,
yeah,
right? It's interesting because it's like essential oils. There's still a lot of like stigma against, like in
yeah.
the traditional medical world, even though we know that like terpenes and lavender oil and things like that actually have physiological changes,
Mm-hmm.
can, you know, have medical applications. And we have a system here where basically if it's not an FDA approved drug, it's not supposed to be able to do anything. And it's
Mm-hmm.
just very odd because we've been treating a lot of symptoms and conditions naturally, you know, for thousands of
Yeah.
years. And some of our drugs that we are using now, where we're like, wow, they're more harmful than
Right,
these
right.
natural substances. What were you doing?
I know. And often those drugs actually stemmed originally from natural things. They just, chemically changed it so much that it ends up becoming harmful. It's like that same idea of like too much of something is not good usually, and
Yeah.
so it's like finding that right balance. So let's tap into the menopause issue, because I definitely know, some of our listeners are in menopause or heading
Mhm.
into, they're in perimenopause and heading
I
into
know.
menopause.
Me, I just like hit it. I was like, really,
Yeah.
perimenopause? I'm like
Here I
38.
am.
Great.
Yeah. Well, this is the one of the things I talk about on here a lot. Like in actuality, most women are going into perimenopause around 35. It's just,
Hmm.
it means that our hormones start to shift at that age. And so some
Hmm.
women don't really feel it until, they're in their 40s or mid 40s. But a
Hmm.
lot of women actually, they're having these things happening at 38 and they're like, I'm too young for this. And I'm like, you're
Hmm.
not. And actually now is the time to really start to work with it so that it won't be horrendous by the time you're in your late 40s.
Hmm.
Yeah.
And you know, there's also some reasons why women will go into menopause like around that age or
Oh,
earlier. So
absolutely.
living at altitude, for example, living in Colorado, I
Oh,
think, or like Mexico City, like any of these like
oh,
high
interesting.
altitude
I didn't
cities
know that.
actually will increase the onset by about a year. Also, certain medications do. Women with epilepsy typically go into menopause a
Mm,
little bit earlier. And so, since in my practice, like I deal with a lot of women who are using cannabis or CBD for seizures, they are also going through
hmm.
like they have no idea though. I'm like, that's not an epilepsy symptom. Like that's
Yeah. Yeah.
perimenopause.
So you're like, I'm sorry to tell you.
Yeah.
So what are the ways that it really can help with perimenopause or menopause?
Mhm. Well, I mean, one of the nice things is that almost every single symptom of perimenopause and menopause, from, you know, confusion, hot flashes, night sweats, headaches, you know, appetite changes, sex drive changes, menstrual cramps, all these things can actually be treated by CBD or cannabis. Again, we're looking for boosting mood. We know that
Hmm.
CBD can activate those serotonin receptors, which does regulate your sleep, your sex drive,
Mm-hmm. Mm-hmm.
and your mood. So, if you're getting better sleep, and you're also regulating your temperature better, you're not going to be as sweaty, you're going to be able to sleep through the night.
Mm-hmm.
A lot of women find that those hot flashes to be very,
Yeah.
just not very disturbing. And
Yeah. And
THC is really,
sleep.
really good
Oof.
for that. Yes.
Mm-hmm.
So
Sleep is
it's
the biggest
interesting.
issue.
So some women like THC better, some women like CBD better. It's interesting. Again, everyone's hormones are slightly different, and what may work for you at the beginning, when your symptoms are lighter, may not work for you as well at the end. And one of the
Mm-hmm.
things I actually, even though I am just 38, I did actually go through chemically induced menopause when I was on specific drugs that shut down my ovaries, because I was literally, I had such bad pelvic pain at one point that I was waking up in ERs, like with a fentanyl drip on my arm. They're like, yeah, you passed out somewhere again. I'm like, how do you even black out from pain? I was like, that's not good. So they shut down my ovaries and everything. I literally went from being on birth control for like 15 years to like menopause, like overnight. Of
Wow.
course, it causes mental health issues as well. That's not very
Right.
fun. But being able to lean into cannabis and go, okay, well, I'm not really using it now, but like clearly I have to deal with these symptoms because I'm waking up drenched in sweat. I went through all the symptoms.
Mm.
And I will say that, using THC, whether it's 5 milligrams, 10 milligrams, could be 20 milligrams, depending on how severe your symptoms are. But that's a great way, again, to be able to go to sleep without having to worry about being high during the day or having to smoke or things like that. I do want to steer women away from, say, smoking cannabis, just because we do know that there are issues. When you smoke anything, you can increase your risk of blood clots. And a lot of women, especially women over 35, if you're still on birth control, I
Oh
would
yeah.
say smoking cigarettes, also smoking joints, because you are burning the matter and you are, inhaling toxins, might increase your risk of blood clots. And so
Mm.
it's something to be really cognizant of. A
Mm-hmm.
lot of times people think, well, it's a joint, it's not a cigarette. Well, you're
It's still,
still
yeah.
inhaling certain
Yeah.
things. So it's not the safest way. So I would
And
say,
especially also with COVID, I want to throw that in there because we want to keep our lungs
mhm,
just as, in tip top shape as we can. And anytime you
mhm.
smoke it can inhibit your lung function.
Absolutely. So, I would say those tinctures are really one of the safest ways to go in managing menopause and perimenopausal symptoms. But there's also some other interesting methods out there. And, because I have to say the word vagina every time I go on a podcast, there actually are vaginal suppositories and rectal suppositories that
Mm-hmm.
have either THC, CBD, or both, depending on what market you're in. And you can even actually easily make these yourself at home with like a little like ice cube tray, coconut oil, and like if you like, you could buy like cannabis oil from a dispensary, like squirt it in the little holes, fill it up
Ah,
with
yeah.
coconut oil. You can actually make your own suppositories at home. The reason why I'm mentioning the suppositories is obviously a lot of the symptoms can be menstrual cramps. You start having periods like irregularly, more frequently, more severe periods, and that pain level really can go up through perimenopause. That's like actually one of the most
Mm-hmm.
common symptoms is like, what's going on with my period?
Mm-hmm.
Like,
Absolutely.
and the nice part is when I was saying that when you put cannabinoids where they need to go rather than trying to smoke and it gets evenly distributed throughout your
Right.
body, if you're going to put those cannabinoids and insert it vaginally, it's going to go right there in your reproductive system.
Right.
And what's
It doesn't have to
nice
get
is
to your
that you
liver to get
actually have
going.
tons of receptors there. So it's going to reduce the inflammation, it's going to reduce the pain, it's going to reduce the cramping. So that is one way to use it. We like joke about it, like in the media, they used to call like weed tampons. It's actually not a tampon, it's a
Mm-hmm.
suppository, but that's one way you can use it. If you're not comfortable with that though, you can still use, say, a lotion on your pelvis, with a heating pad. It'll help it penetrate
Mm-hmm.
better and may actually get in there and, reduce that cramping and pain and things like that. So there's a
Nice.
couple options for you. Again, also works on your back too, because, all of our nerves hit the same thing, pelvic pain, back pain. So you put on your pelvis, put on your back, you're all set.
Right.
And, in terms of, lubrication and things like that, that's another thing that women that go through menopause, like, you're like, okay, my sex life
Yeah.
is hurting.
Yep.
And a lot of the lubes out there, of course, they're not great for us to begin with. They might have chemicals and things like that. What's nice is that there are several products on the market or the legal market that are either formulated with just CBD. For example, there's a brand called Foria, Foria.
Okay.
They're great. They have a CBD one that you can order from anywhere, and it's
Nice.
formulated with other types of ingredients, and will actually, increase blood flow to the region. Like actually applying THC or CBD to that area will make you more sensitive. So it'll help with, maybe some arousal issues. It actually increases orgasms. Like it basically
Nice.
will bring you back to speed, like when you were 20.
Yeah.
So,
That's
yes, seriously. So, if you have been lacking in that area or been frustrated, I would definitely say try it out. Go with the CBD one first. Definitely, some women are actually amazed. They're like, wow, this is like awesome. I don't need anymore. Or they'll try the THC one first and they're like, too many orgasms, too much. I can't deal. So if you're sensitive down there, just
stick with
make
the
sure.
CBD to
Yeah, just
start.
stick with the CBD
Yeah.
one. But yeah, it's completely safe to use and it doesn't get you high or anything too. A lot of women are concerned when you use either cannabis infused lube or you use a suppository, it's not going to really go in your bloodstream or get you high.
Right.
And so
Right.
it's sort of like a one-off experience, but it is really helpful. And I think it also keeps that little fragile, tissue down there really just healthy and moisturized and things like that. And it also keeps the pH balanced, right? Because coconut oil is actually really healthy for our reproductive area. So, I think that there's a lot of benefits, a lot of different ways to use it. I would say pretty much when we're going through those changes that we're almost endocannabinoid deficient, where like we need as much as possible. And if that helps us rely less on traditional, treatments for menopause, I would much rather prefer that. For example, like when you take ERT, like estrogen replacement therapy, it can cause, like there are some health risks associated with that.
Yeah. You
And
don't want
there's
to
some,
jump to that, especially if you
yeah,
don't know, if you haven't done a hormone test and actually know, please don't
yeah.
take estrogen unless you absolutely
Yes.
know.
Yeah.
Yeah.
And I mean, there's a lot of women too that can't do that
Right.
anyways.
Because
Like, for
of
example, I have
cancer,
blood
breast cancer.
clots,
Right.
I can't
Yep.
use that. And
Yep.
so these options, out there being that cannabis can almost act sort of like a identical
Identical.
hormone.
Yeah.
Yeah.
So I do have a quick question because we talk about this a lot on the show
Yeah.
because
Yeah.
I've had a fibroid and went through, trauma around that. But do you know anything about with the vaginal suppositories, if they can help around things like fibroids and cysts and polyps and all that good stuff?
Yeah. So if you use them regularly, of course, like not when you're like, oh my God, I just had a cyst burst or something. I'm
Right.
going to use it for pain. You can use it for pain afterwards. It's
Mm.
helpful. But in reality, the best way to use it if you do have those kind of severe issues is to use it regularly. And so we're talking about at least twice a month, if not weekly. And that's where, actually making your own at home is helpful because otherwise it can be like $16 to $17 per dose.
Wow.
Still not the end of the world, but
Right.
that can be expensive, if you're trying to treat yourself. But I would say that having those cannabinoids in there can stop a lot of different issues. And so we do know, say for endometriosis, that it's actually not just treating the pain, it's actually treating the condition because it actually stops the migration of these endometriosis cells and things like that.
Nice.
So there's a lot of things that are happening. So it's like THC does one thing, CBD does another thing. There's actually a lab in Israel that has put $6 million towards clinical research for cannabis for endometriosis.
Sweet. I mean, we need that really because endo is
Yes.
so big now,
Yes.
it's so many women are affected by it.
Yeah, and I mean, to have to go through surgeries or through
Yep.
these chemical treatments where, you're hoping it works, it doesn't, or hysterectomies. The number one thing that
Exactly.
it just breaks my heart. Everyone has a hysterectomy, and you're like,
Yep.
but that didn't even cure the disease. Like that's not,
Absolutely.
that's,
I
how
know.
did that
Well,
happen?
even with fibroids, they push you towards hysterectomies. I mean, especially because I said I didn't want children, and I was
Mm-hmm.
39 at the time. They were like, oh, just go ahead and have a hysterectomy because the fibroid's going to come back. And
Yeah.
I'm like, no, first of all,
Mm-hmm. Mm-hmm.
and B, it just is insane to me that we don't talk about, well, why is the fibroid showing up in the first place and working on
Yeah.
that,
Yeah.
and
And
yeah,
I think that there is actually a lot to do, with our reproductive health and the toxins that are in our environment. And so we know things like BPA, it's
absolutely.
like on every receipt, by the
Absolutely.
way. It's not in our water bottle anymore, but it's on
Yeah.
every receipt
Yeah.
we touch, we
Well,
absorb it.
and
Like,
the plastic bottles have other forms that are
yeah.
just as bad essentially, like they're like, oh, it's BPA free, but it has like BP whatever one of the other ones
Yeah.
is, so it's everywhere. It's in our shampoos and it's in things we use on our face. Yeah.
Well, because this topic really hits home for me, because I spent a lot of times in hospitals with like ovarian cysts that had burst and all sorts of horrible pain. I actually wrote a section in my book Vitamin Weed about
Oh.
reproductive health, and so one of the things people don't realize is that you can actually cause this similar receptor physiology for endometriosis, where you have like less cannabinoid receptors in that area, which is probably why you have inflammation and pain and like a whole dysfunctional like area. Like endometriosis is actually thought to be a endocannabinoid deficiency disease, actually just like fibromyalgia is. There's like 3 diseases where everyone gets all of them like together because it's like actually the same thing. But in terms of how do you make someone look like they have this disease? Well, you actually can expose them to specific toxins, and it will reduce the number of cannabinoid receptors in their reproductive system and make them look like they have endometriosis. So it's like dioxins. There's certain things that we are exposed to all the time. And so, you know, they're in your bloodstream. Even as a baby, you have levels of these hormones, like these hormone disruptors in your bloodstream. And so I believe that if we had removed our exposure to these horrible toxins, that these conditions would happen less. Or if we just sort of, you know, again, like approved, like, hey, you know what, you have a family history of, you know, some of these reproductive health issues, you know, maybe you should be taking CBD as, you know, an insurance policy instead of getting it and then being like, oh my goodness, what do we do now that you've had damage to your system for like 10 years before your diagnosis? You know, because we know these diseases don't start, you know, when you're like 30, like they're starting when you're
building up.
They're like you were 15, but like nobody really told you that painful periods were like more than just oops, Papa Tylenol. It was actually a problem. So
Whew. Oh my goodness. I could ask you so many more questions, but we'll probably need to wrap it up here in a minute. But I do want to ask you about your big brother time. So this was this after you had been diagnosed with fibromyalgia?
No, it was before. So I had just finished my PhD. So I finished in 4.5 years. I moved to California. I was working at Caltech. And then, of course, like my boss was just like, oh, you're this pretty blonde girl. You're probably going to get picked for TV or something. And I was like laughing. So I was like, no, like I'm a scientist. Like the most absurd thing you've ever said to me in my life. And then, of course, 3 months that I'm there, I get picked. Like out of the blue, I'm not like trying to be on TV or anything.
Interesting.
And they were casting a scientist for that season. It was the first year they ever had. And I was like the first scientist on reality television. So part of it, I mean, I actually was a fan of the show. I had watched with my family. I'm the oldest of 4. So I don't really watch a lot of TV. So that was it. So I had to say yes. Also, you know, there was another aspect where, you know, as a woman, I hadn't seen many scientists on TV. I hadn't seen many women scientists. And so like when I was trying to think about it, I was like, who's on science on TV? Like Miss Frizzle from like some science cartoon and like Bill Nye the Science Guy.
Right. That's about it.
Like, that's horrible. And so I hadn't seen a woman scientist myself until I was 22 years old. I really only met men, and that's awful. And so here I was 26. I was given this opportunity. I did the show. It's very competitive. It's like Survivor in a house where you're like hanging off of ropes, doing things.
I can't even imagine. I couldn't do it.
Dude, okay. It's interesting because it sometimes teaches you what you have in you. And so I'd always thought of myself as a very nerdy, intellectual person. I'm not that social, you know, like I hang out with lab rats. Like it was sort of funny. I wasn't the confident person that you see now. And what I realized that was competing with these people, whether, you know, there were Marines and things like that, and actually beating them at competitions for strength and things like that, was that you don't know what your strengths are until you're put to the test. And I learned how strong I am. And actually that strength actually really helped me in my my health journey and my fight to like stay alive, because I was like, I'm not a quitter. If I can hang from a rope that's spinning at like 80 miles per hour for 4 hours with like beat a Marine, I can beat this disease. I can hang on there. I can do this. And I think it actually gave me the strength for my fight later. And I like, I'm strong. Like some people are like, I really don't know how you've been through this all, but all of us, you know, pain warriors, chronic illness warriors, you know, we are really strong. And so, you know, sometimes you have to develop that muscle, but sometimes, you know, life has strengthened you up one way or another. So I'm really grateful for the opportunity to have met so many people through being on TV. I'm well known in a lot of countries and things like that. And it helps me be able to share my journey with fibromyalgia, with endometriosis, with all these different issues, and gave me a platform to really help women, you know, be their own advocate for their health and also learn about cannabis. So I'm really grateful. It's a really weird journey. I like have the weirdest career of any other scientist.
I'm like,
I know.
all the good ones are weird though. You know what I'm saying? Like, and especially the groundbreaking ones, like what you're doing, you know, it's like, you don't come to that in just kind of a normal fashion, like just being a scientist and then suddenly you're teaching people about, the benefits of cannabis. Like you had to go this path to get there.
Yep.
And I mean,
Yep.
this is why I do the work that I do now, because of going through, nearly dying from sepsis and having that fibroid surgery go awry. And it's like, well, okay, this is this whole world of hormones that, women are definitely not empowered around
Mhm.
at all by their, most of their doctors. And so it's like, yeah, getting this information out there to people. And especially I think the time in history that we're in, right? It's like power's got to go back to the people.
Exactly.
And
I'm all about, I don't want to be your doctor. I don't want to be your healer. Like what
mm-hmm,
I want you to do is empower you to be your healer, because the
mm-hmm.
plants have all the knowledge. You just got to
The good
tap
stuff.
into that and heal
Yeah.
your own family.
Yeah. Well, it's been fascinating to talk to you. I really could ask you like so many more questions, but I'm definitely going to get your book because I really appreciate that got to talk about, some of the specifics about reproductive health, because I think that's so important for women to know. So everybody else check out that. Do you prefer people getting it at your website or
Amazon
elsewhere?
is fine.
Amazon.
Yeah.
Okay.
Yeah.
Get it from your website first though, right? um, so yeah, thank you so much for being here today. And people should just be in touch with you via either of those websites or
Yeah,
yeah.
drmichelleross.com is great for,
Okay.
in general. But,
Hmm.
because my passion is helping fibromyalgia patients, I actually do have a group coaching program
Nice.
where I do 3 times weekly group coaching with my
Awesome.
patients. So that's like, if you have fibro, you got to join.
Yeah, absolutely. And that's so helpful when you're having anything that you're facing like that, to have a group of people to support you in the process who are going through the process too. Are you on
Absolutely.
social media too?
So I am Dr. Michele Ross, DrMicheleRoss, one L there. So
Hmm.
everyone, I'm
Yep.
like,
One
that
L.
other
Yep.
Michele Ross is not me.
Not it. And that's Instagram, Facebook, or
Instagram, Twitter,
all,
Facebook, all that
all the
stuff.
good stuff. Cool.
Mhm.
We'll have those in the notes so people can click directly to you and everything too. So, well,
Perfect. Thank you.
thank you so much for being here today. This was awesome. I learned a ton, and I'm looking forward to learning more through your book.
Perfect. Thank you
Yeah,
so much.
absolutely. All right, guys, I'll see you next time.